Hello there friends, how are you doing today? I hope you are doing well. Today we are going to talk about lipoma. Definition: a lipoma represents a benign tumor of subcutaneous fat. Clinically, it is a rubbery nodule that appears only slightly elevated above the skin's surface but is easily palpable deep in the skin. The origin is unknown. Incidence: most lipomas are never brought to a physician's attention. When they are, it is because of the patient's concern that the lesion may be malignant. They are most common in midlife. History: lipomas are usually asymptomatic. They may grow slowly, but most patients are not aware of any change in size. Physical examination: a typical lipoma is flesh-colored and imparts a slight elevation to the normal-appearing outlying skin. It feels rubbery but not hard and is usually freely movable. Lipomas range in size from 1 to 10 cm, rarely larger. They may occur anywhere but are found most often on the trunk, neck, and upper extremities. Differential diagnosis: angiolipomas are uncommon tumors that are often painful and sometimes locally invasive. Histologically, they have a prominent vascular component. Metastatic malignant tumors of the skin can be deep but usually are firm if not hard and also involve the dermis, so the skin cannot be freely moved over them. A lipoma may also be mistaken for a soft tissue sarcoma, which is harder. The conclusion of differential diagnosis of lipoma include epidermal inclusion, cyst, angiolipoma, and malignant tumor. Note: lipoma is a stable or slow-growing, movable, rubbery subcutaneous nodule. Note: a lipoma usually is deeper, more freely movable, and more rubbery than an epidermal inclusion cyst. Laboratory and biopsy: the diagnosis can usually be made clinically when any doubt exists, particularly if a malignant tumor is even remotely suspected. A biopsy should be performed. One needs to be sure that extend the biopsy deep enough to sample the tumor. A deep elliptical excision is preferred. Histologically, a lipoma is an encapsulated collection of normal fat cells. Lipoma: deep, movable, flesh-colored, rubbery nodule in dermis impinged on by encapsulated tumor or normal appearing fat cells is present. Therapy: therapy is usually not required, but in the case of need, excision is the choice of therapy. Course and complications: lipomas found incidentally by the physician are usually reported by the patients to have been present without change in size for a number of years. For lesions recently detected or those that appear to be growing, a biopsy should be considered to confirm the diagnosis. These lesions have no complications. Clinical case: a 47-year-old man presents with a soft, painless lump on his left upper arm that he noticed about 1 year ago. The mass has slowly increased in size but has never caused discomfort. On examination, there is a 4 cm soft, rubbery, mobile subcutaneous mass that is easily movable under the skin and not attached to deeper tissues. The outlying skin is normal. There is no lymphadenopathy. Which of the following is the most likely diagnosis? A. Epidermal inclusion cyst. B. Lipoma. C. Dermatofibroma. D. Abscesses. And E. Liposarcoma. According to our explanation, the correct answer of the choice is B, or lipoma. Explanation: lipoma is a benign tumor of mature adipose tissue presenting as a soft, rubbery, mobile, painless subcutaneous mass, commonly found on the trunk, neck, shoulders, and extremities, slow-growing and usually asymptomatic. Differential diagnosis: epidermal inclusion cyst is a firm, dome-shaped nodule with a central punctum and may become inflamed. Dermatofibroma is a firm, hyperpigmented pupule with a dimple sign on lateral compression. Abscess is a painful, warm, fluctuant, erythematous swelling, and liposarcoma is a deep, firm, rapidly growing mass and may be painful, not freely mobile. Okay, this was an explanation about lipoma. Thank you for your attention.